And good afternoon, everyone, and welcome to this afternoon's Dalubhayop Tech Talk. We are coming from Puerto Princesa City in Palawan, Philippines. I am Dr. Ian Hagmis, and I'm a member of Dalubhayop, and I'm from Pets United Veterinary Clinic. Dalubhayop is an affiliate of PVMA and is composed of veterinarians practicing here in Palawan. Right now, we are also live on our Facebook page and in this Zoom room this afternoon. You may want to go to our Facebook page. That's Dalubhayop. Kami naman yung likes. 117 lang yung likes. And then this Tech Talk is a series of talks about veterinary medicine and other topics. Like next week, we will have heartworm disease, and also a week after that, on the first week of June, we're talking about stress, COVID, and financial management. Today's Dalubhayop Tech Talk is in partnership with UP Tarapigani ang mga Palawenyo, a versatarian organization of students from UPLB, and also Elanco. And I'll introduce to you my co-host this afternoon. They are Rosela Espino, a student and member of Tarabidan, and also Dr. Carla Adorable of the regional animal here in Puerto Rico. Before we begin, I ask everyone to turn off your microphone para walang echo. And then I'd like to call on Dr. Quintero for the opening prayer.
Okay na ako. Okay na?
Doctor.
Panginoon, salamat sa araw na ito at meron kami uling tech meeting. Salamat at binigyan mo kami uli ng speaker who unselfishly wants to share his time at kaalaman sa amin. Salamat at meron din kaming masipag sa Dalubhayop, yung presidente namin at ang sekretarya. Panginoon, patnubayan at gabayan mo po kami sa araw-araw. Keep us and our family safe and healthy. We ask this in Jesus' name. Amen.
Amen. Rosela?
Yes, ayun. Hi, everyone. So, I would like to request everyone to just mute your microphone, and then later on, during our question and answer portion, you can unmute it in order to ask questions if you want to our speaker. So, now, to introduce to you Dalubhayop, may I call on Dr. Orestes Borja.
Thank you very much sa napakagandang introduction. Narinig ba?
Yes, Doc.
Welcome to the Dalubhayop, samahan ng mga dalubhasa sa pagmutang hayop sa Palawan. Dalubhayop is an association of licensed veterinarian in Palawan and with presently address or based at Puerto Princesa City. It was organized and founded last 1994 with 9 members, spearheaded by late Dr. Jerry Ortega, and its primary aim is to work for the welfare of the membership and veterinary profession. It also aims the aim of the association also is to unite all the members of the veterinary profession in the province of Palawan into a single body capable of playing an important role in the promulgation of professional and ethical standard of the practice of veterinary science and medicine. So Dalubhayop is presently represented by more or less 20 to 25 members. And Dalubhayop is an affiliate member of the Philippine Veterinary Medical Association, or PBMA. So we have the same mission also. The Dalubhayop exists to protect the rights and interests of the members, promote their professional development, and enhance the recognition of veterinary profession, particularly in Palawan. So, noong mga nakaraang mga years, ang activity ng Dalubhayop ay we conduct lectures, information drive lectures, particularly on rabies and other emerging disease that involves the domestic animals at yung livestock. Last 2014, dito ginawa yung PBMA, and we co-sponsored dito sa PBMA Palawan, 81st PBMA Scientific Convention. So, besides from that, ay nakagandak din ng mga vaccination, lalo na sa aso, ligation, and other similar activities dito sa Palawan. And lately, ito yung ating webinar ginagawa para ma-enhance yung kalaman ng bawat veterinaryo, at the same time ay magkaroon pa ng bagong skills, knowledge sa mga emerging na mga sakit at yung mga mahalagang topic na pinag-uusapan ngayon. Yun po yung mga iba-ibang mga activities ng Dalubhayop dito sa Palawan. Welcome po at magandang hapon sa ating lahat.
Ayan. Thank you, Dr. Borja, for letting us introduce the Dalubhayop. So now, to welcome our speaker for this afternoon. Our speaker is a graduate of Doctor of Veterinary Medicine from the University of the Philippines, Los Baños, in class of 2005, with relevant postgraduate credentials on veterinary, ophthalmology, wild and exotic animal medicine, and earth health investigation. He was a former resident of the UP Veterinary Teaching Hospital and has had 15 years of clinical experience in small, exotic, and wild animal practice. He owns Manila East Veterinary Care with several branches in Metro Manila. He was a dynamic contributor to the profession during his stint in the Veterinary Practitioners Association of the Philippines and the Philippine Veterinary Medical Association House of Delegates. He is currently active in promoting zoo animal welfare through the Philippine Zoos and Aquariums Association and the Southeast Asian Zoos Association. He is also actively conducting research on wildlife trade and rescue through a project with the Asian Development Bank. Currently, he is Elanco Philippines Technical Consultant for Pet Health. Let's all welcome Dr. Lester Lopez. Afternoon, Doc. Ayan, nakamute po kayo. Ayan.
Good afternoon. Ayan. Okay. So we're ready? Start na tayo?
Yes, Doc.
Okay na. Alright. Clarification, Doc, Ian. The poll. Where do I put the poll?
After na, Doc, ng isang topic.
Okay. Alright. Sige, actually nilagay ko siya sa front and back. So, of the topic. let me just... Okay, everyone is seeing the presentation?
Yes,
Yes,
Doc.
yes.
Yes,
Okay.
Doc.
So let's start on our first topic. So good afternoon again, everyone. I'm Lester Lopez. I'm the Technical Services Mentor of Elanco, and I have a clinic in Quezon City. It's called Manila East Veterinary Care. So this afternoon, I'll be sharing with you two medical concepts. One is on the diseases of the thyroid gland, and the other one is on fluid therapy. Medyo sinimplify natin these topics for easy understanding and better application in the practice. Okay, so before we start, I'll be putting up this poll here, but you will be answering this later after we do the discussion. Okay, so check what do you think is the most important laboratory test that we will require when we are trying to diagnose hypothyroidism in dogs. Okay, read the answers and we'll get back to that one after this presentation para meron na kayong better grasp ng discussion natin later. All right, so the discussion this afternoon will focus on the thyroid glands, its structure and functions, and two conditions that are affiliated with it, which are hypothyroidism and hyperthyroidism. Okay, let's start. So what's a thyroid gland? It's a two-lobe gland located sa neck region. It produces several hormones. Four of the most important are the thyroid-releasing hormones, the thyroid-stimulating hormone, the triiodothyronine hormone or T3, and the thyroxine hormone or T4. The process is the TRH and the TSH regulates the release of T3 and T4 into the circulation. So what happens in a normal metabolism or metabolic activity, so that hypothalamus is stimulated para stimulate niya ang thyroid reproducing hormone towards the pituitary gland, which in turn is stimulated towards the thyroid gland, yung thyroid stimulating hormone, which then releases the T4, the T3, and T4. The difference, the T3 is actually metabolized after the T4 has gone through release into the circulation. So what are the functions of the thyroid glands? The main function, the main regulatory function of the thyroid gland is with regards to the metabolic rate. So yung speed ng metabolism. That's why later you will notice with regards to hyper and hypothyroidism, the symptoms would actually also relate to the rates of metabolic processes that can become symptomatic. Halimbawa, if it's low in production, magkakaroon ng mas mabagal. Pag mataas yung production, mas mabilis yung kanyang effect dun sa system. So what are the metabolic processes involved? It is involved in the protein buildup, in amino acid buildup, together with the other hormones in the body, including insulin. And then there's also metabolism of protein, fats, carbs, and vitamins. And calorigenesis, or the metabolism of calories needed for energy. It is also involved in the nervous system and the cardiovascular system. And it is involved in fetal development. All right, let's start with hypothyroidism. So when do we diagnose that it is hypothyroidism? First, let's try to review first. There are 5 types or 5 pathogenic pathways into which the hyperthyroidism develops. The first one, the primary hypothyroidism, is lymphocytic thyroiditis, which basically is nagkakaroon ng autoimmune disorder yung thyroid gland na hindi siya nire-recognize ng katawan. So the thyroid cells are actually destroyed by the body. Idiopathic atrophy is when it becomes smaller anatomically. Then you have your secondary hypothyroidism, which is when there is tumor or there is persistence of the Rathke's pouch in the pituitary gland because nagkakaroon ng obstruction yung flow ng thyroid hormones. So, dito, the symptoms can actually develop or develop at the same way with regards to different types of hypothyroidism. The tertiary one involves the hypothalamus, where there is infiltration or tumor of the hypothalamus. There's also congenital or juvenile hypothyroidism, which is also called cretinism. This is related to the persistence of the Rathke's pouch in the pituitary gland because the hormones are not allowed to circulate, or it is the connection, normally the connection between during development of the fetus, the Rathke's pouch actually nawawala, dapat siya nadidissolve siya. But if it becomes persistent, the hormones actually are blocked from being distributed into the circulation. And then of course, there are cases of idiopathic hypothyroidism. Ang nakikita lang dito, actually babalik ka dito dun sa primary hypothyroidism, which is nagkakaroon ng loss in volume or size nung thyroid gland. So what dogs or patients are usually affected? The median age is usually 7 years old. Between 5 to 10 years old are the most common ones that are affected. There's no sex predilection. Male or female can be affected on equal footing. However, those that are spayed female, they are reported more, most likely because of the decrease in the androgynous hormone circulating in the system. Again, this is still connected to the thyroid gland, because remember, this is the thyroid gland hormones are, it's part of the normal metabolism. The top breeds that are usually affected by thyroid hypothyroidism are Airedale Terrier, Cocker Spaniel, Dachshund, Doberman Pinscher, German Shepherd, and Miniature Schnauzer. So if you can find them in the picture there, very good. Mahirap siya hanapin. Okay, those are all the breeds in the world. The picture of the dogs you see there. Right. So, what are the symptoms of hypothyroidism? So let's start with metabolism. Like I said earlier, it affects the rate of metabolism in the body. So when there's hypothyroidism, the dog will usually exhibit lethargy and then they become obese. There are skin and coat changes, which includes hair loss, hyperpigmentation, and poor hair quality. Then sometimes it doesn't happen much, but it can happen that there are neurologic disorders in the dogs also. Minsan may megaesophagus. So from the front, meron din effect sa back, yung constipation naman. Pwedeng merong neuropathy or vestibular disease, ear disease, pwede mag-develop yon. There are also reproductive disturbances like gynecomastia or development of the mammary glands in the male, irregular cycle, which can actually lead also to pyometra. There is also dwarfism and impaired mental development, especially if hypothyroidism manifests when they are very young. And then there is myxedema also, or swelling of certain tissues in the body. So, how do you diagnose hypothyroidism? Several tests that can be done include your blood test, urinalysis, and your thyroid function test. With the urinalysis, you want to make sure that there's no underlying disorder. There's no underlying or interconnected problem, for example, with an underlying diabetes also, or glucose in the urine. Okay, so with CBC, what you normally see is there's anemia. With the biochemistry, there is elevated cholesterol, triglycerides, SGPT, and SGOT, or liver function, and increased glucose. With the urinalysis, you do not see that increase in glucose, but you will usually see elevated or counts of protein and white blood cell. And the most important one would be a decrease in the circulating thyroid and your total thyroid and your free thyroid or FT4. So ano yung difference nila and bakit nandyan silang dalawa na dapat i-measure? The total thyroid actually is the one that is produced in total by the organ, by the glands. The FT4 or the free thyroid is the one that is actually more important because this is unbound. Ibig sabihin, hindi siya affected ng metabolic activity. So this is the true amount of the thyroid hormone that is circulating. So you get the total thyroid and the free thyroid. The free thyroid will be your confirmatory. So this is the one that is very important with regards to diagnosis. When diagnosing also, you have to make sure you're differentiated from other diseases that are most commonly associated with it, which is yung Addison's. Because remember that an untreated hypoadrenocorticism can lead to a false hypothyroidism reading. Madali lang naman ito yung cortisol level reading and yung total thyroid, yung TT4 and FT4 reading mo. Now, with regard to non-thyroid illness syndrome or euthyroidism, wherein there are symptoms of hypothyroidism, but you are not getting the confirmatory test with the thyroid hormones, you can check this by using yung thyroid stimulating hormone test, which is with the use or with the measurement of thyrotropin in the bloodstream. So with this, there are special laboratories that can do this. Check in Palawan where they can do this. Usually yung mga human labs, see if they can do this for us, for vets and for vet patients in your laboratories there. Makakatulong ito sa inyo if kumbaga parang nagpo-false negative kayo doon sa inyong diagnosis ng hypothyroidism. So a true hypothyroid will produce less than 1.5 micrograms per DL ng total T4 pre and post treatment. And then dapat consistently, dito i-measure din yung T3, consistently low din siya usually. Okay, ano yung treatment natin dito? Mayroon tayong tinatawag na thyroxine. There are both human and animal preparation in the market. Levothyroxine is available for dogs. The dose is at 0.02 milligram per kilogram. The dose range can be once a day to twice a day, depending on the response of your patient. You need to check the total thyroid TT4 and then free thyroid hormones, the FT4, 4 to 6 hours after the first medication is given. So it means yung patient nyo kailangan magstay sa inyo at least overnight to monitor if nagkaroon nga ng changes dun sa kanyang thyroid level. Now, going back here, you have to make sure that you are not dealing with other hormone problems because this one, levothyroxine, is actually contraindicated for Addison's. So hindi natin siya pwedeng gamitin kundi lalong magmamanifest ang symptoms ng Addison's. Meron bang alternative medicine for hypothyroidism? Not directly, not as effective as your thyroid hormone replacement. There are supplements, minerals that you can give like iodine and selenium and zinc, B vitamins also. These are part of treatment that covers herbs, homeopathy, nutraceuticals, and glandulars. But again, your main treatment option would still be levothyroxine or the thyroxine hormone replacement. Kapag kapag na-diagnose on hypothyroidism and then nag-start na ng levothyroxine, this is most likely, well, almost 100% na lifelong na yung treatment ng levothyroxine, ng thyroxine or levothyroxine. You just have to monitor the thyroid levels from time to time. You have to check if may symptoms na magde-develop. You have to check if merong ibang hormones na magiging affected. Like for example, yung sa female kanina na merong irregular heat, pwede siyang mag-develop ng pyometra. So you have to monitor all that. Kumaga mas mataas yung risk nun sa kanya. Okay? So that's something that you can discuss with your clients. It's if you will notice, sabi kanina din, di ba? Sabi ko kanina, kapag mas mataas yung chances na nangyari sa mga spayed na female because of the reduced reproductive hormones. So, kumaga, it's an interconnected na hormone function. Kapag naman masyadong mababa pag masyadong mababa yung kanyang thyroid hormones, eventually, kapag meron siya reproductive symptoms, pwede naman siya mag-lead sa pyometra. So, tatanggalin pa rin yung kanyang uterus. Yeah, but it's something that you can discuss with your clients. Okay? Any questions on hypothyroidism? Meron tayong questions?
Ay, Doc, mag-change topic na ba tayo or
Di pa naman. If you have any lang while we're here. Wala naman? Sige, let's move to the next one. Yung hyperthyroidism in dogs pa rin ito ha. So, the hyperthyroidism naman in dogs, this is not that common sa kanila. When it does happen, some of the things that you would need to consider is you have to look for certain types of possible cancer. Kapag benign cancer siya, usually nagkakaroon ng adenoma or hyperplasia or nagiging hyperplastic yung thyroid gland, or pwede din siyang maging thyroid carcinoma, which is yung malignant type naman. What are the influences of hyperthyroidism? You have genetics, you have diet, you have yung mga biphenyl ethers natin. With diet, this refers to yung iodine dun sa diet nila. Ang median age nito, usually mas matanda yung mga affected na patients. 13 yung median. So the range would be between 10 to 15 years of age. And then like your hypothyroidism, wala naman siyang sex and breed predilection. Ano yung symptoms nito? So you can see the picture there. That is, there is an increase in size of the thyroid gland, and this becomes palpable. There usually is weight loss, increased appetite, increased urination, increased defecation. There could also be vomiting and diarrhea. Similar to hypothyroidism, there could also be hair loss. But the difference is dito sa hyperthyroidism, ginawin sila. You would see them na parang nag-shiver even when they're in a warm room or nasa corner lang sila natutulog. Constantly parang nag-shiver sila. What is also significant here is there are cardiorespiratory symptoms that you could observe, like tachycardia or arrhythmia, hypertension, dyspnea, and tachypnea. And then there are also musculoskeletal symptoms like weakness. Usually, hirap sila or nahihirapan silang tumakbo ng mabilis. Not necessarily may pain na pinapakita, pero parang mabagal sila sa movement or responses nila. Okay, compared kanina dun sa ating hypothyroidism, in hyperthyroidism, makikita mo, usually meron stress leukogram, and kanina anemia dito, usually elevated ang hematocrit and yung MCV values niya. Pero so hindi siya anemic. Sa biochemistry, mataas din ang liver enzymes, pero mababa ang glucose levels, and azotemia may or may not be present. You can verify this by checking your creatinine and BUN, and your creatinine and BUN ratio. With urinalysis, there also is protein and white blood cell in the urine, and you would observe that there is low specific gravity. And similar to your thyroid exam kanina, you could draw blood and check for the thyroid hormones. Here, there is, of course, there's elevated total and free thyroid hormones. Then there is also another way of diagnosing thyroid problems in dogs and cats. Usually, this is done in cats kasi easier to handle sila. But this can be done both in dogs and cats. And most often, ang nakikita dito is yung hyperthyroidism because of the enlargement of the size of the thyroid glands. So this is a nuclear imaging that provides anatomical and physiological values for the thyroid glands. This is actually the gold standard in diagnosing hyperthyroidism, mainly in cats, but dogs can be can use this one also. The injection of the radionuclide dose is given subcutaneously after about 20 or 30 minutes. The animal is scanned and then the results come out. So this does not require sedation. The results you will see are like this. So you would see the gland. So you would see there, this is a normal sized thyroid gland, but this one is an enlarged one. Okay, now I'd like to share a video with you of this scintigraphy. Let me know if there is audio, ha?
Ay, Doc, walang audio.
Hi, Doc Lester. Walang audio, Doc Lester.
Okay, sorry. Okay, where do I... Jomer, saan yung audio?
You have to go back, Doc, doon sa Zoom platform. Tapos doon sa arrow to share screen, pag kinlik mo siya, may lalabas na dialog box. Sa baba, merong nakalagay na share with audio.
Okay, let me do that. Wait.
Sit comfortably. How about
Meron
like
na?
Meron na,
Okay na.
Doc.
getting ready to a thyroid scan on Red, who's a hypothyroid cat. To do this, we use a gamma camera. This right here, we're going to put him on top of what's called a collimator. Normally in people, this would be flipped around and this big machine would come down on your neck when you're lying on your back. Cats don't like to lie on their back, so we flip this around. We're going to put Red on top of this collimator to make it a little more comfortable. Put a towel down. Dr. Ritchie's going to bring Red over. And all he has to do is kind of relax, just kind of sit comfortably, about like that. That's all he has to do. And as we do this, we injected Red with a radioactive dye about an hour ago. So now this radioactivity has gone into the thyroid gland. We can look over here at the computer and you can see the thyroid tumor is being taken up by that little white spot there. And we can also go over here to the main computer And if you look at the screen on the computer, you can see the tumor coming up here also. So I'm just going to press the start button. We collect 250,000 counts. That sounds like a lot of counts, but we can get that in less than a minute in most cats. So I'm going to start it. During the scan, no sedation, perfectly happy, not very stressed at all.
It can also be used. However, because you will be removing the thyroid, one consequence can actually lead to hypothyroidism. So you will need to deal with that one also. So eventually, when symptoms of hyperthyroidism stop, you have to measure, you have to monitor the, you have to eventually provide external thyroid source sa kanya, sa patients nyo. Kung hindi naman siya tatanggalin if you will only do iodine restriction in the diet, so make sure lang na within level yung kanyang thyroid hormones. Sa cats, kung papansinin nyo, medyo mas baliktad naman siya. In cats, hypothyroidism is less common. It's rare compared with dogs na mas common ang hypothyroidism. So in cats, this is rare because this is due to the destruction of the gland itself. Symptoms are similar to your hypothyroidism in dogs, which shows slow metabolism. Mild cases, usually asymptomatic, wala naman masyadong symptoms yung pinapakita. Most often, yung advanced cases lang yung may symptoms. And then treatment, of course, similar to hypothyroidism in dogs, is replacement of the thyroid hormone. Levothyroxine can also be used in cats. Sa hyperthyroidism naman, this is more common in cats, yung hyper. And this one, similar to dogs, is caused by a tumor, but more common by a benign tumor. And similar to your hyperthyroidism in dogs, symptoms are related to fast metabolism. And treatment also is similar to the ones in dogs, which is radioactive iodine treatment or surgical removal. And then again, this will eventually lead to hypothyroidism, especially if you opt for surgical removal. So you need to be ready to address that. You need to prepare your clients also to address that because that is a daily medication for life. Okay? All right. So going back to our poll question earlier, what do you think is the most important, or what do you think are the ones that you need to check when you are trying to diagnose hypothyroidism in a dog patient?
Everyone, you have a minute to answer the poll.
Right. Okay, so your poll answer is the total thyroid hormone, TT4. Tama ba? Actually, dalawa, di ba? Yung sabi natin kanina, TT4 and FT4. Okay, so yan yung dalawang kailangan yung i-measure and i-monitor when you are diagnosed or you have diagnosed a hypothyroid or hyperthyroid patient. Okay, all right. That ends your first part. Any questions? Sabi ko naman sa iyo, I'll make it simple for everyone para madali niyong mai-apply, maintindihan at mai-apply sa clinics.
Doc Lester,
Yes, Doc.
oo, may i-introduce lang si Rosella before we proceed with the next topic.
Ayan. So, hello again, everyone. So, I would like to request for you to edit your profile name. So, if you're a vet student, write your name and then the initials of your university after your name. And if you're a veterinarian, put your name and then the name of your company or your clinic. And I would like also to remind and request for everyone to please turn on your camera in courtesy of showing respect to our speakers. And later on, for our question and answer portion, or during discussion, you may opt to leave a question in our chat box, and you may use the raise your hand button. Also, for the link of the presentation and the digital certificates will be provided after completion of post-meeting survey. And if you're wondering how to change your name, you may click this logo participants and then look for your icon and then rename. Ayan. So, for now, before we proceed for the next topic, and to know more about the Elanco company profile, I would like to call on Dr. Jomer Fule.
Hello, good afternoon. So let me just share my screen. Hello, good afternoon, everyone. So, in behalf of Elanco Philippines, we would like to thank you for giving us this opportunity this afternoon na makadaupang palad ang bawat isa in order to impart some knowledge on the given topic that was requested from us. Now, this afternoon, let me also take time to also introduce yung aming company and naging updates regarding Elanco Animal Health. So, yun po. So, making life better for animals makes life better. So, before we go into details of our company, let me share to everyone regarding what really drives us in the company. So it all starts with animals and the people that care for them. So at Elanco, we believe that healthier animals can be a solution to some of the world's significant challenges. So in Elanco, I think lahat naman in all companies, the always objective is the welfare of people, or it's the enriching the lives of people. But we in Elanco, as a pure animal health company, we want to do it. We want to enrich the lives of people by caring to the animals that are very important in the lives of people or everyone, of all human beings on the planet. So sabi nga, we are a focused animal health company, but we want to create value for the farmers, for the veterinarians, for the pet owners, because creating and taking care of animals, we believe also is taking care of the people to which these animals are very important. And that's why in our company, our vision is food and companionship, enriching lives. So sabi nga ko nga kanina, we want to enrich the life of people through touching or taking care of the welfare of the animals that are very important in human beings. And I think this vision became more important in these trying times na tinamaan ang Philippines ng African swine fever, and also we are on the COVID pandemic. So ngayon na-realize ng mga Pilipino or ng many people around the world that the importance of animals in providing protein for our nourishment, the importance of agriculture, of animal agriculture in order to provide for our nourishment to different countries around the globe. And also, the COVID pandemic puts into focus the importance of companion animal. And I think many of us here in this session is involved in companion animals. So ngayon na nasa COVID pandemic tayo, people are forced to stay at home. And in order to address the mental condition ng mga tao, naging malaki ang role ng mga companion animal, particularly in dogs and cats. This is one reason maybe in the last year, the pet health industry is one of the industry that really grew nung nagkaroon ng COVID pandemic. So ganun naging ka-importante ang companion animal, ang dogs and cats to the lives of people, especially these trying times. That's why our promise is that we want to be your advocate. Also, yung mga veterinarians, mga farmers, or anyone involved in animal welfare, we want to be your advocate. We want to be your partner in order to improve the health standards, the health of animals, and also to create value, not just of our products, but also to providing expertise. And I think that's one of the purpose talaga kung bakit nung sabihan kami ni Doc Ian na, can you discuss about these two topics? Sige, we are very much willing to do so. So who we are? This is the history of Elanco. Just a brief history of Elanco. So the company started in 1954. So we are relatively mga nasa 60 years, 66 years in existence pa lang. But when we started, actually, we are part of LIDD. So we are the LIDD Agricultural and Industrial Sales Division. And then between 1954 and 1960s, there had been a reorganization in order to put more focus talaga on agriculture. Kaya in 1960s, nire-organize ang Agriculture and Industrial Sales Division ng LIDD. And dito ipinangalan or dito nagsimula or came into existence ang Elanco. If we look at Elanco, the name Elanco really is an acronym. It means Eli Lilly and Company. Between 1970s, it's marked with continuous expansion around the globe. We put up more manufacturing plants in different parts of the globe. In 1960s, we put more focus in R&D, and so is in 1990s. And then way back in 2000, Elanco wanted to do more. We wanted to expand more. So we partner, we merge with other companies, we acquired other companies in order to be able to provide more focus on animal health and also more solution to our customers, particularly mga veterinarians and mga farmers. In 2018, there was one milestone again with Elanco, and that is Elanco went out from LIDD or separated from LIDD. So right now, Elanco is an independent company. Hindi na siya connected with LIDD. And another milestone in the last couple of years, and this happened only last year, is that Elanco acquired Bayer Animal Health. So we know that Bayer Animal Health is one of the company that is very strong in companion animal. So with Elanco and Bayer Animal Health together as one company, we believe that this merging we will be able to provide more solutions to our customers. And that's, I think it has not been more proper yung merging ng Elanco and Bayer Animal Health. Why? Because the values of these companies, kung titingnan talaga natin, is halos pareho. If we look at the mantra or the vision ni Bayer, sasabihin ang mantra nila is science for a better life. So, ganun din ng Elanco. Ganun din ang Elanco. So, it's enriching the lives of people through taking care of our animals. So, halos pareho or the same ang values ng dalawang company. And that's that makes the merging of two companies more proper. And we believe the merging of these two companies, we will be in better position in order to provide for the needs of our farmers, of our companion animal veterinarians, especially to address yung mga challenges or mga dynamics na nangyayari sa veterinary practice. Particularly in pet ownership, there had been an increase in pet ownership in the couple of years. Pets are living 20 times longer, so we want to be able to be there in order to support the health of our animals in their older ages, and then the growing need of our pet owners in order to provide better care for their pets. And same with farm animals. So the population around the world is growing, so they need more products, they need more expertise in order to make the farm animal production more efficient and more sustainable. And with these two companies merging and combining together, we would be in better position in order to provide and address the needs of agriculture and companion animal veterinarians. Just a little statistic on Elanco. So as I mentioned, we started in 1954. We are based in Indiana, Greenfield, in Indiana, in the USA. We have more than 10,000 employees. However, I would like to imagine that there had been a lot more right now because of the merging and merging with Bayer Animal Health. And we have more than 20 manufacturing facilities. And again, I want to emphasize that we have more than 20 manufacturing facilities right now because of merging with Bayer Animal Health. In 2019, our pet health business is valued at 2.1 billion, and almost the same with the farm animal revenue. We have more than 200 brands globally, and our products, and we are present in around 90 countries around the world. We have major launches in the past 4 years, and I think this is 2020, we are within the top 4 in all major markets in globally. So, yeah. So what do we do in Elanco? So sabi nga natin, food and companionship, enriching life. We are committed in advancing our vision of food and companionship, enriching the life by recognizing the impact of healthy animals on health and people and the planet. In order to do this, we want to provide not just innovative products, but of course, expertise and health solution to our veterinarians, farmers, pet owners. For pet owners and farm animal owners, we want to promote companionship and human-animal bond sa ating mga pet owners. efficient and sustainable food production for our farmers. And we want to also observe in the society in giving back. And I think isa siya sa mga, when I joined Elanco this last year, I was amazed na how yung CSR or yung company social activity ni Elanco is very much active. Not only for activities that are involved in animal welfare, but also on human welfare. Product areas of focus, so we focus on animal health, particularly on pet health. We have pet disease prevention products for pet health, pet therapeutics for pet health. For farm animals, they are more focused on more efficient and sustainable production for our animals, and particularly on swine and the ruminants. So here in the Philippines, we also have a strong presence in poultry, and we are also developing our presence on aquaculture. Just to give a brief background of our portfolio globally, so for farm animal products, we have mga vaccines, we have for poultry that are being used to address coccidiosis. We have antibiotics for our swine and poultry. For coming from Bayer Animal Health, we have antibiotics such as Simbatril, Catosal. Locally, they are known as Coforta. We have Bicox, anti-coccidiosis, and as I mentioned, mga vaccines for poultry. For pet health, so we brought from Bayer yung mga parasiticides such as ang Seresto, Advantage, Advocate, but this also, but Elanco, Legacy Elanco also has mga products that are used for pet health such as Interceptor, Trifexis, but these are products that are present in other countries, but we'll see how we can develop it further into our local market. So disease prevention, pet disease prevention, as I mentioned, have parasiticides, and majority currently of our portfolio locally is on parasiticides. We also have vaccines for our dogs. Chronic diseases, currently we have products for otitis, but these are present only in other countries. We'll see how it goes in the next few years here in our local market here in the Philippines. For our farm animal, we have nutritional products, probiotics for poultry, aqua. So we are also investing into this market, into these practices in order to provide for our farmers. Cattle, swine, we have both Bayer and Elanco had always been strong in this market, and combining those two companies gives us a better position again to address the need of the cattle and the swine industry, both local and abroad. And also we have antibiotic stewardship. We in Elanco have this 8 antibiotic plan wherein in order to promote the responsible and the use of antibiotics in agriculture. Just to give a short rundown of our products here in the Philippines, or our local products currently available here in the Philippines. So we have ethical lines and we have yung mga OTV and OTC lines. So from our ethical lines, ito yung ating Advocate, Practic, Seresto, Drontal, Milbemax, Bateril, Coforta, and our Biovac, which is yung ating mga vaccines. So just a quick rundown, maybe for benefit din po ng ating mga, if we have students on the call. So imidacloprid, we have Advocate. So basically, this is an endectocide used to address both internal and external parasites in dogs. It is a combination of imidacloprid and moxidectin. I do remember when I used to be a student, long time ago, the first macrocyclic lactone that was used in small animals was an off-label use. Now, with the advent of and development of technology, we were able to modify the macrocyclic lactone in order to make it safe and for our companion animal, So, and Advocate can be used in puppies, can be used against fleas, lice, mites. So for internal parasite, it can be used for the prevention of heartworm. And I think this product is one of the drug in the market that has a broad spectrum of activity on external and internal parasites. So if we have spot-ons or Advocate for dogs, of course, we have then also Advocate for cats. The only difference of Advocate for cats is magkaiba yung kanilang content ng moxidectin because cats are more sensitive to macrocyclic lactone. It's safe to use in kittens, 9 weeks and up. But in terms of spectrum, it has a broad spectrum against external and internal parasites. So coming from the legacy Elanco, we have Pyriprole or yung Practic. So it's a spot-on solution for dogs. So if Advocate is used for internal and external parasite, but Practic is mainly used for external parasite, particularly on tick and fleas. Na yun naman yung hindi ganong nako-cover ni Advocate yung tick. So we also have Seresto. It's an imidacloprid flumethrin. We have 2 pack sizes of this. We have yung Seresto for 8 kilogram dog and above. And we also have the small one, the Seresto for less than 8 kilogram dog. But it can also be used for cats. Can be used in kitten 10 weeks of age and older, and in puppies 7 weeks and older. The good thing about Seresto is it can protect your dog and cat against external parasites for around 7 to 8 months. So it treats and prevents fleas, and as a contact parasiticide, it controls the flea allergic dermatitis in our companion animals. So it kills and repels ticks. It also addresses the biting and chewing lice that may affect our dogs. We also in Elanco have Dorontal, or we have oral tablets for internal parasite, particularly yung ating Febantel, Pyrantel, and Praziquantel. It's a combination of these 3 active ingredients in order to optimize yung kanilang synergistic effect. It can be used in puppies. It's safe to use in puppies as small as 2 kilograms and above. It can be used in pregnant and lactating animals. Following then yung recommendation ng TROCAP. So it can be used for roundworm, hookworm, whipworms, tapeworm, and Georgiasis. So if you are going to use this as treatment for Georgiasis, you can give it for 3 consecutive days. If we have Dorontal tablet for tablet, we also have the Dorontal Plus Tasty for puppies. It is an oral suspension. It contains Febantel and Pyrantel. So ang wala lang sa kanya ay Praziquantel. It can be used for roundworm, hookworm, and whipworms that may affect our puppies, even at the small age. So in addition to our Dorontal, we have Milbemax. It's a tablet containing milbemycin, oxime, and Praziquantel. Milbemycin, being a macrocyclic lactone, is useful for roundworm, hookworm, whipworm, and a prevention for the microfilarial stages ng heartworm. And given that it has Praziquantel, it can be used to address tapeworm that may infect our dogs. We have 2 preparation or 2 strengths of this. We have yung 2.5 milligram milbemycin, oxime, and Praziquantel na 25 milligram, which is mainly used for puppies and dogs weighing less than 5 kilogram body weight. For dogs weighing more than 5 kilogram to 25 kilogram body weight, we can use ng adult preparation ng Milbemax. But again, this dewormer is safe to use in puppies and in pregnant and lactating animals. On antibiotics, we have Baytril, we have enrofloxacin. We brought it from Bayer. So we know that it covers a wide spectrum of gram-positive and gram-negative bacteria that may infect our companion animal, and it is also used in farm animal practice. So sabi nga sa farm animal practice, if every antibiotic fails, then use Baytril. So ganon ang how well known Baytril had been in farm animals, and it can also be used in our companion animal. So given that it is enrofloxacin, and because of its wide distribution in different parts of the body, of organ system in the body, can be used for infections that affects digestive, respiratory, uterine, reproductive, and ear infections, in particular, and also urinary infections in our dogs and cats. For Baytril, we have the injectable solution. It comes as a 2.5% injectable solution. 25 milligram per ml, can be used in dogs and cats at 5 milligram per kilogram, can be given subcutaneously once a day for 5 days. Our recommendation is it can be given as a treatment in the clinic, and then when the patient goes home, the treatment can be continued using our tablet preparation. If you also have ornamental birds as a patient, it can also be used at 20 milligram per kilogram intramuscularly once daily for 5 to 10 days. This is the tablet preparation. It comes as a 50 milligram tablet. In dogs, it can be used at 5 milligram per kilogram once daily for 5 to 10 consecutive days. So as I mentioned kanina, this can be used to continue the treatment at home once yung loading dose ng Baytril injectable has been given in the clinic or hospital. To supplement, as a mga supplement, our companion, our patient, we have Coforta. It contains beta-phosphate and cyanocobalamin. Basically, the active ingredient of this is used as a tonic to provide energy in times of stress in the animals, in dogs and cats, especially in hospitalized dogs and cats. It can be given at 0.5 to 5 ml, either IM, IV, or SC. It can be given together with the IV fluids, with Doc Lester will be discussing afterwards. This is also especially useful for recovering animals from diseases. So especially doon sa ating mga animals that are confined in our clinics. So for our vaccines, we have BioVac R1 vaccine. It's an inactivated rabies vaccine that can be used in our dogs and cats. We have BioVac 5-in-1, DHPPI plus leptospirosis vaccine. It's a modified live vaccine for use in our dogs. For our BioVac, actually, you can use yung ating BioVac R1 vaccine as a diluent for the solid part ng ating BioVac PPI vaccine. So basically, that's our company and the products that we can offer locally. It would be exciting, sana, to have visit you in your clinics or in your offices. However, yun nga, ang mga, because of the COVID restrictions, there have been limitations on traveling. But we hope in the next future, you would continue to reach out to us in order to inquire from us, or to let us know what particular and how we can particularly help you in your practice and also make a difference in the lives of your patients and your clients. So we are always willing to listen, and we were always willing to help you in any possible way. So with that, we would like to thank you, and I would like to give the floor back to Doc Ian or Edka.
Thank you very much, Doc. Rosella?
Ayan. Thank you so much, Dr. Jommer, for the brief introduction of Elanco. So, now we'd like to call Miss Kat. Miss Kat, are you there? Hello, Miss Kat.
Hello, good afternoon po.
Ayan, Miss Kat, hello.
Magandang hapon po. Kamusta po kayong lahat?
Okay naman po. So, may pag-ibig
Kamusta
daw
ang
po
Palawan?
tayo.
Hello po.
Maulan
Okay
ngayon,
naman
maulan.
po. Maulan-ulan. Wala pong masyadong init.
Sige po. So, ako na po ba?
Yes
Share
po,
ko na
yes
ba?
po.
So, ito po, para naman po tayo ay magkaroon tayo ng konting break. Medyo mahaba-haba na po yung ating oras sa technical. So, ito medyo muna po tayo, mag-break muna po tayo. So, nakikita niyo na po yung screen ko?
Yes po.
Yes,
Ayan.
yes.
Sige po, itago ko lang pa. Yan po. So, yung game po natin is emoji quiz. So, meron po tayo dito mga emoji, tapos ang category po natin is places sa Philippines. So, kung alam niyo po yung sagot, pa-type na lang po sa chat box. Tapos kung sino po yung mauna, siya po yung mananalo. Bali, meron po kami hinandang prizes po meron po tayong first prize po, Drontal paperweight, and tapos may constellation prizes din po na hinanda po sa atin ni Doc Len. Tsaka, ayan po. So, ito po. Magpa-sample muna po ako. Okay lang po ba? Sample tayo, sample.
Sige po.
Sige po. Wait lang po, slideshow ko lang. Okay, here is slideshow. Sige po. So, bali ito po yung first. Sample lang Pauna po tayo mag-type guys, pa-check na lang po kasi sinong nauuna. So, ito po. First word. Galing naman ni Sir Adrian. Yan, ganun po. So, ganun lang po yung ating game. So,
trial lang po ba yun, ma'am?
Opo, Tagaytay.
Trial lang yon.
Trial lang po. Opo, trial lang. Okay, so ito na.
Game.
Ito na po talaga to. Okay. So, ready na? Ready, guys? Okay.
Ready.
So, ito po. 1, 2, 3. Ay, kita nyo rin naman actually. Mahilit lang. Ayan. First word. Yan, may nakatama na. Tama po. Bicol. Bicol. Tama.
Ma'am, nakikita ata yung mga other items. Pwede niyo pong i-full screen para hindi makita yung yung next items.
Ayan. Para hindi
Ayan, perfect.
Okay. So, sa second word po tayo. So, sa nauna po ay wait lang check ko po. Ang nauna,
Si Dr. Adrian yata.
ayan, si Doc Adrian ulit. Sige po, ito po, second word po tayo. Wait lang po. Ayan, number 3. Hindi ko lang makita, guys. Pa-check na lang po. Yan, tama po. Tama po, may nakakuha na po. Si Dalubhayop, Palawan.
Si Doc Ian yata.
Si Doc
Ian, kayo po ba yun?
Si Doc Ian po ito.
Yay!
Congratulations, organizer.
Third word po, third word. Go, guys. Meron na ba? Aba, si Doc Alea. Doc Alea Rama. Thank you po, Chocolate Hills. Tama-tama. Mga tourist spots to Sige po, next word po, next word. Ready na? Ready? Manda na po ba ang mga mata? Ito guys. Ay, sorry. Masarap yung mag-swimming dito. Aba, si Doc Rafael. Congrats po, Batangas po. Tama, Batangas. So, okay pa? Ito po, may second. Meron pa po ito. Marami pa.
Teka lang, ma'am.
Makakabawi pa po tayo.
Teka lang, ma'am. At may nagtitake notes ba kung sino yung nanalo?
Doc, I'm writing
Sige
down
po.
po.
Thank you.
Panag-writing doon din po. Sige pa. Ito pa na, next word. Medyo... Sorry, naka-screen nga pala ako. Ayan. Tama po. Kirino.
Ang bilis naman.
Ang gagaling na ako. Parang walang hindi na pa nag-iisipan. Ito po, ulit. Nakuha na po kasi nung nauna, Dr. Mer.
Dr. Christine Ann Concepcion. Congrats po.
Next. Ayan. Marami ring magandang dito lugar. Go guys. Ayun, tama po. It's Butuan, Doc Rosel. Congrats po si Doc Rosel nga po ito. Si Dr. Patty Ortega po pala. Sorry po. Congrats po, Butuan. Tama po, Butuan.
Hindi ba
Nakuha
gusto?
po, Doc Domer. Po?
Si Dr. Patty Ortega. Tama ba?
Yes po, Dr. Patty Ortega. Sige po, meron pa po tayong konti pa po to para makahabol. So, next word. Ayan. Madali-dali. Yun. Meron na po, tama po. Copies. Ang gagaling. Copies.
More!
More. Ito po. Meron pa po. Ready na? Next word. Yan. Ang dami na nakahula. Tama po. Igan. Ang gagaling
Si
nyo
Doc
ba?
Rafael ulit.
Thank you. Galing-galing Next word. Ready na? Ready na guys? Ito po. Nako. Dr. Maria. Tama, Dr. Adrian. Tama po, Abra.
Dr. Adrian.
Dr. Idris. Dr. Adrian, parang sanay na sanay sa emoji quiz. Ayan po. Ready na for next word? Go. Tama po, Bacolod. Ang galing naman nila. Ang gagaling nyo po. Doc Zomer, nakuha po natin sino? Bacolod, tama po, Bacolod. Congrats.
Si Doc Adrian ulit.
Doc Adrian. Okay po, next. Meron pa po. Makakahabol pa. Yan. Go guys. Hindi. Dr. Janela. Tama. Si Dr. Janela, tama po. Tagig. Stag and gig. Ang gagaling. Doc Zomer, nakuha nyo pa. Tagig po to, tagig. Tama po si Dr. Janela.
Yes, nakuha ka.
Yan. Mayroon pa po tayo. Meron pa po. Next word. Yan. So guys. Ayun, meron na po. Opo, binakuha na si Antipolo.
Si
Antipolo. Ang
Dr.
galing.
Raisa Lagrimas.
Ang galing. Okay po. Doc Jomer, nakuha niyo po?
Yes.
Yan po.
Si Dr.
Next.
Raisa Lagrimas.
Go pa. Congrats po sa mga nakakasagot. Ito po, meron pa po tayo. Yan. Gagaling.
Oh,
Tama po, Palawan.
sayang.
Ang galing.
Yung kay Doc Sol. Ang tamang sagot ay yung kay Doc Sherwin, Palawan.
Opo, nagkatay po.
Hala,
Palawan.
Sherwin! Baka
Sayang.
naman.
Sayang. Kamali ng tay. Teka, let me just get the name, sorry. Dr. Sherwin Ragonton.
Congrats po. Parang may kaunti na lang ata to, dalawa na lang. Ito po.
Doc Jomer, yung mga may name ng school after ay mga students.
Okay. Opo. Sorry, Doc.
Ito last po. Last two. Ayan. Go guys. Tama po. Cotabato. Tama po. Congrats po. Nagkaano lang. Congrats po, Cotabato.
Si Noivy Jean Reyodava. Dr. Noivy Jean Reyodava.
Yes, congrats po, Doc Novi. Last one. Last na po ito. Ready, guys? Yan po. I love you too po. Wala pa nakakasagot. Wala na po bang sasagot? Buhol. Tama po si Doc Raisa Marel. Buhol. Congrats po, Doc Raisa, nag-iisa. So,
Congratulations! Ang galing niya naman.
galing talaga, as in, parang walang kahirap-hirap.
Thank you very much.
Thank you very much for participating, everyone.
Thank you po sa pag-cheers. Sana nag-enjoy po kayo. Meron pa naman po itong marami, pero sige lang po. Sa susunod, itatago ko muna po. Pero salamat po sa pag-participate. Sana nag-enjoy kayo. Good po.
Hindi man lang ako nakasagot.
Congrats po sa lahat.
Congrats sa mga nanalo. Ayan, so moving on with our program, would like to call on again for Dr. Lester Lopez for our fluid therapy session.
Alright. Gising na ha. Start na tayo nung 8. Okay, everyone seeing the slide? Okay na? Sige, let's move to our second topic, which is in fluid therapy in dogs and cats naman. So we have another poll question. You will be answering this again later after the discussion. What is the most critical aspect of fluid therapy? You only have to choose one among the 4 choices. Okay, so mamaya discuss uli natin yan. Also, magre-request ako na everyone get a piece of paper and a pen or pencil kasi mamaya din meron tayong sort of exercise para sa inyo with regards to fluid therapy. Siguro alam nyo na yung gagawin, ano? Mamaya, titignan natin kung tama lahat, kung naintindihan natin at tama yung ginagawa natin sa clinic na fluid therapy. Okay, so this is the flow of discussion on the second topic. We'll be defining what fluid therapy is, the types of fluids, the routes of administration, and yung computations na gagawin natin exercise mamaya towards the end of the presentation. Okay, let's start. So what is fluid therapy? It's the rapid replacement of water and electrolytes lost by the body. Pwede siyang emergency, pwede siyang rehydration, but it's basically a replacement of lost fluids in the body. Pwede siya doon tinatawag natin dito na rehydration phase kapag ito yung halimbawa chronic yung problem. Halimbawa, merong mga diseases, merong losses because of vomiting and diarrhea, merong losses because of certain diseases like kidney problem or liver problem, yung mga ganyan. Ang emergency type naman, this is the type of losses na very acute. Halimbawa, pwedeng nagkaroon ng accident, nagkaroon ng open wound, may blood loss, halimbawa, hit by car or nahulog, yung mga ganun klase ng mga losses. So ano ba ang objective ng fluid therapy? Of course, we want to make sure that the fluid loss is replaced. So lahat ng deficits, whether it's fluids, electrolytes, or yung mga pwedeng crystalloids or colloids, yung mga colloid materials like blood or plasma are replaced, are correctly replaced sa katawan para bumalik yung normal balances ng metabolism. Fluids can also be a vehicle for the infusion of certain intravenous medications, especially when your patients are confined in your clinics. So to better understand yung fluid therapy, balik lang tayo dun sa very basic ng fluids sa katawan ng aso. So madali lang actually siyang tandaan. Remember the 60-40-20 ratio. 60% of the total body weight is composed of the total body water or body fluids. Sa 60% na yon, 40% actually are ICF or intracellular fluids. Tapos 20% actually are extracellular fluids. Yung 40%, ito yung fluids na nasa loob ng mga cells. And then yung 20%, so 60, 40, 20, ito yung extracellular fluid na nasa interstitium at saka intravascular na space. So kasama dito yung mga blood vessels, yung mga ganyan. Bakit important na natatandaan na nalalaman natin ito? Kasi this is how we will be able to decide which fluids yung gagamitin natin. Kailangan ba natin ng fluids na isotonic lang, na kumbaga equal lang yung kanyang osmolarity? Kailangan ba natin ng hypertonic or hypotonic para magkaroon siya ng enough force para pumasok sa extracellular space or sa intracellular space. So yan yung magde-decide kung alam natin kung ano yung deficit ng pasyente natin. Okay, this is basically another illustration of that concept, kung ano yung mga dapat na meron sa intracellular at saka sa extracellular space ng katawan. Okay? So kanina, nasabi ko na kung ano yung acute versus chronic. Acute usually ito yung mga accidents, yung mga high intensity na accidents na pwede mangyari sa animal na merong large fluid losses sa katawan. Chronic naman usually yung mga may sakit, secondary to diseases like liver or kidney disease na may vomiting and diarrhea, or may viral infection or bacterial infection. Now, for us to decide kung anong klaseng fluid therapy yung gagawin natin, step by step yon. So kanina, identify muna natin kung anong klaseng kung anong klaseng condition. Is it acute or is it chronic, para alam natin kung ano yung i-replace natin. Pangalawa, syempre, dahil kasama to sa computation, you have to check for the dehydration of your patient. Wala naman ibang actually way to do it. One is to check yung physical attributes ng pasyente nyo. So, titignan mo yung mga signs ng dehydration sa patient. So, physical, meron ba yung parang droopy yung eyes, or nakalabas yung mata, or dry yung nose niya, na-chap na, dry yung mouth and gums, pwede din yung excessive panting. So, physical examination dun sa aso. Aside from that, you check yung skin turgor. So, ito yung tinatawag natin na skin tempting. Titignan natin kung you see in the figure here, or dito sa cut, kung nare-retain yung tenting ng skin or yung folding ng skin at hindi siya bumabalik dun sa normal integrity niya right away. Usually within 2 to 3 seconds dapat nakababa na siya kaagad din. Pero if the tenting remains, then you have an indication of dehydration there. Meron naman tayong guide na pwedeng gamitin with regards to percentage because this one, remember, this is qualitative. Siyempre, kailangan natin yung quantitative form niya para magamit natin doon sa computation ng fluid therapy. So ano ba yung mga titignan natin dito? So percentage will be equal to yung skin turgor computation or reading or observation, yung mucous membrane moisture, and yung ocular position. You can also check for the history of your patient and see if merong mga conditions na the ones listed there that could help you determine with the percentage dehydration na meron yung inyong pasyente, which basically are also the ones you find here. Yung mga symptoms at saka yung presentation ng patient mo. Okay? So it can go from less than 5% to as much as 12 to 14%. However, dun sa 12%, that is considered an emergency situation. And then the 14%, yan yung there's not ano na eh. That's the point of where there's no turning back already, kumbaga. Okay? So, tingnan mabuti yan. You can screenshot it. You can copy it. Okay. So, types of fluids naman. Balik tayo dun kanina dun sa unang discussion natin sa kung anong part ba ng katawan yung nagkaroon ng losses. So, dito papasok yung types of fluids na gagamitin natin dun sa ating patient. We have so many kinds of fluids that you can use, including yung mga colloids natin. So isotonic crystalloids, these are the most commonly used fluids. This the sodium content of this one is similar to the extracellular fluids yun sa space na yon. So mostly ginagamit siya as replacement in maintenance. So ginagamit siya kapag hypotensive at saka hypovolemic yung patient. Examples of fluids ito would be your lactated ringers, normosol, ringer solution, your NSS, which is about 0.9%, and your dextrose in 0.45% sodium chloride. You have naman your hypotonic solution, which is a whole body replacement that can replace both ECF and ICF fluid losses. So these are helpful naman when cells are dehydrated. And these are used in patients in diuretic therapy and also those with hyperglycemic condition. So kasama dito yung low percentage dextrose, which is only 2.5 and 5%, or dextrose in water or dextrose in sodium chloride. Or LRS can also be used here. Ang hypertonic solution naman, this is retained only in the ICF. And this helps stabilize blood pressure, increases urine output, and decreases edema. So this is used for patients with hypovolemia. An example of this one is your 7.5% sodium chloride. Okay, never use your 7.5% sodium chloride in your hypotensive or hypovolemic patients because yung fluids niya actually will not be moved into the ECF. Okay, so hindi siya magagamit ng katawan. It could actually lead to overloading on your ECF. Ang colloids naman, so these are large particles retained primarily in your intravascular space. These are expanders, and this includes plasma, whole blood, dextran, hydroxyethyl solutions. Okay? So yung mga ginagamit natin usually kapag immediate replacement during emergency conditions. So again, bakit importante na malaman natin ito? Kasi we need to know which space we are filling, which space we are replacing para hindi ka magkaroon ng complications sa fluid therapy mo. Okay? So that's the list of the conditions that you can use your fluids in, and you can correlate that on the spaces where they will be applied on the left side of your screen. Now, what are the routes of administration of fluids? Unahin natin yung pinakamadali, yung oral administration. So you use this only for small patients, usually less than 20 kilograms, so mga neonates to small to medium-sized dogs or cats. But you have to make sure that they have functional gastrointestinal tract, meaning walang vomiting. Pwede gamitan nito yung mga anorectic or yung mga ayaw kumain na patients. And then this is usually used for short-term illness conditions. So yung fluids, you warm it a little bit, and then via syringe or orogastric or nasogastric tube, feed it to your patient. Yung mga kailangan mo ingatan dito, you have to make sure that you do not cause or produce aspiration pneumonia. Avoid also air administration because remember this is directed towards the stomach and the intestine. So putting air there would actually cause pain. And then this is, of course, contraindicated in patients with hypovolemic shock and those which are vomiting. From one end, dun tayo sa kabilang end. There's also the rectal or per-rectal administration naman. And these are usually used for patients which are intolerant of oral administration and make sure na hindi impaired yung kanyang colonic function, which means wala siyang diarrhea, walang difficult or constipation, normal yung kanyang bowel movement, kumbaga. So these are used in neonates also, in young and small dogs and cats. And it can also be used for patients with hepatic encephalopathy, those especially which are vomiting and which will require rapid absorption. So through the rectum, using a large bore catheter or syringe, you insert the required fluids rectally. Okay, this can be done once or twice a day, depending on the fluid requirement of your patient. There is yung subcutaneous administration, and I'm pretty sure ginagamit nyo rin lahat ito, lalo na doon sa mga outpatients na merong kidney problem or vomiting or hindi ma-confine or, well, yung cause ng pag-confine is hindi kaya or ayaw magpa-confine. So this is used for patients with mild dehydration, not severely sick. Yung vomiting and diarrhea is controlled, and then you have to remember that the subcutaneous fluids is resorbed within 6 to 8 hours of injection. So here you'll have to use only isotonic fluids because those are the ones that can only be absorbed through this route. You can use a gauge 18 to 20 needle to insert the fluids, and yung parang quick computation, that's about 10 to 12 ml per kilogram per injection. So if you have a 10-kilogram dog, you have to give your dog at least 100 ml once or twice a day, depending on the fluid requirements. Okay. So this is contraindicated for patients with replacement therapy because, again, this is only for mild dehydration. If you need a bolus injection, or if you need a continuous IV drip, you have to do an IV drip that way. And this is also contraindicated for patients with devitalized skin kasi it will be very painful if you inject pa yung infected or inflamed na skin. So saan ka ba pwedeng mag-subcutaneous injection? Shoulder area at saka dun sa waist ng dog. You have two spaces on the left and the right of the waist of the dog or dun sa back of the skin, dun near sa shoulder area. Those are the ones which are stretchable and quite spacious enough to accommodate the skin, to accommodate the fluids under the skin. If you need to give medication subcutaneously, those are the same areas that you will use. There are medications that you will need to, or you can include or mix with your subcutaneous fluids. You can do it in the same areas. There's also the intraperitoneal administration. Although this is listed, it is not commonly used because of the complications primarily. You have to make sure you are in the peritoneal region, and then you have to make sure that everything you use are sterile so that you would not be introducing bacteria, for example, into the peritoneal cavity. So ginagamit din ito kapag nahihirapan mag-IV or hindi kaya or kulang yung subcutaneous fluid therapy niya. Kasi this one is mas mabilis yung absorption niya compared with the subcutaneous fluids. Also kasi syempre pag nag-peritoneal cavity, syempre unless you are guided by an ultrasound, baka kung ano yung matusok natin doon sa cavity. You have to be careful with this one. One that is more commonly used compared with intraperitoneal, this one, the administration is your intraosseous or intramedullary administration, although this is more commonly used in neonates, small cats and dogs, and also in small mammals, yung mga exotic pets natin like rabbits or guinea pigs na mahirap i-IV. So the needle is born into the proximal medial tibia or sa tuberosity, distal surface tibial tuberosity or greater tubercle of the humerus. Tapos, doon mo idadaan yung fluids na ipapasok mo dun sa pasyente. This type of administration, you keep this about 24 to 48 hours only because you want to make sure that you do not risk infecting the bones. Mas mahirap kapag infected yun, mas mahirap gamutin. Kasi yung penetration na antibiotic dito. And then of course, the one that we are most familiar with and hopefully we are all comfortable with would be the rapid fluid therapy via the intravenous administration. So lahat naman kaya ha. So ano ba yung mga ginagamit natin? Usually yung cephalic at saka yung lateral saphenous veins. You can also use the accessory veins near it, near these two, if you're having a hard time or if you need to replace the IV line that you've initially set up. So you have your usual IV line, the cephalic and lateral saphenous vein. You also have your IV cut down. If you need to isolate and expose the vein better, ginagamit ito kapag hirap hanapin una. Ginagamit din ito if you need to use the vein longer. And then there's also central line if you need more fluids directly infused into the body of your patient. So ginagamit natin ito kapag severely dehydrated or hypovolemic yung patient. You have to make sure when you do this that you monitor the IV line, monitor that there's no phlebitis that is developed. You have to make sure na lahat ng ipapasok through the IV line are injected in a very sterile manner. Like you have to wipe the nozzle where you will inject your medicines or your adjunct medicines or your adjunct IV line doon sa iyong catheter. Okay, let me show you. I borrowed videos from YouTube which shows yung sa IV line natin. So we have students here. This will be very useful. All right. So those are the three types of your IV fluid administration. Okay, let's now move to the computations. So there are actually several recommendations on, how do you say that? Not corrections, but modification on fluid therapy. But there is a basic formula that we will be using. Okay, on the rehydration process, on rehydration phase, the basic formula is this. It's body weight times percent dehydration as computed with the parameters earlier discussed times 1,000. Usually your replacement volume is computed at about 80% of the volume that you have computed. This is to ensure that you have you do not go beyond the estimate and do not cause overloading. Okay. So yeah, so very basic. Body weight in kilograms times percent dehydration times 1,000 times 0.8. This 0.8 can actually be on or off the formula. The maintenance volume, on the other hand, is body weight in kilograms times 30 plus 70. And then you have to compute also for the ongoing losses, which is either you compute by frequency times estimated volume. For example, if your patient has vomited 5 times and maybe computed around 80 ml of fluids are being ejected per vomiting. So 5 times about 80 ml, that's your ongoing losses. Or it can be the estimated volume lost times 2. So these losses include those sensible and insensible losses, like those that are produced by vomiting or diarrhea, or natural processes in the body like perspiration or panting, where fluids are actually lost by the body. So when you have all these three computed already, you add them together, you have your total fluid replacement, which you will be using in your first 24 hours. Okay, so replacement volume plus maintenance volume plus ongoing losses. The infusion rate naman, so this is computed based on this formula. So that's infusion rate in milliliters per hour divided by 60 minutes times 60 minutes if you're computing by the minutes, or 60 minutes divided further by 60 seconds if you're computing by the second, times the drops per ml of infusion system. The infusion rate in ml per hour is your total fluid requirement here, computed here, divided by 24 hours. Then you have here the drops per ml of your infusion system. If you're using an adult infusion system, that's 20 drops per ml. If it's a pediatric infusion system, that's 60 drops per ml. Okay? There are actually shortcuts which you can use. A normal infusion rate would be 5 to 10 ml per kilogram per hour. There's a fluid rate for surgery or anesthesia. It's about 10 to 20 ml per kilogram per hour. Fluid rate for patients with cardiopathy, lower ito than your normal infusion rate at 3 to 5 ml per kilogram per hour. And if you are in the emergency phase, you have severe hypovolemia, you can actually infuse 90 ml per kilogram bolus on your patient. The emergency phase indicated there is if you need to provide rapid administration, you compute about 60 to 80 ml per kilogram for the first hour, and then evenly distribute the calculated total volume as indicated in the formula earlier in the next 2 to 24 hours. This is for emergency cases. There are two formulas that you can use for the first hour. You can give the first 25% also, and then in increments of 25% plus the replacement volume in the next hours, in the first 24 hours. And then during another option on the third hour, if there is not much improvement, you can switch or add colloid in your volume. Modern clinics now or hospitals actually have infusion pumps. You only have to compute for the total volume, and then any of these machines can actually do the dispensing of the fluids for you. Okay, medyo marami naman na tayong clinics or hospitals dito sa atin na meron na nitong mga ito. So what are the risks in fluid therapy? There are actually two main risks. First one is your inadequate fluids. If you're not putting enough, and you're not fluids in the heart, and you're not putting enough replacement, it could develop into poor pulse quality, increased heart rate because the body is trying to pump out more fluids. There could be hypertension, there could be decreased urine output, and of course, there's weight loss. On the other hand, there could also be fluid overloading if you will not compute for it properly. There may be tachycardia, there may be increased in respiratory rate, there could be edema, bulging of the eyes, there could be swelling of the eyelids or the conjunctiva, there will be increased urine output, and there will be weight gain also. Remember, for a confined patient in fluid therapy, you have to monitor them every day at least 2 to 3 times every day to make sure that their weight gain from the fluid lost and the fluid that you are trying to replace are properly recorded and that they are proportionate to the body weight, to the initial body weight of your patient. Okay, everyone still here?
Yes, Doc.
Sige, ready na tayo sa exercise? May mga papel na kayo? Yung papel, ipipakita nyo sa screen nyo ha. Magtatanggal ako ng share. Tapos kailangan makita ko yung mga sagot nyo ha. Paggawa natin. So remember the formula earlier. This is our exercise. This is the case. So you have a 10-kilogram dog presented due to inappetence, vomiting, and diarrhea for about 2 days already. Estimated dehydration was 7%. Emissions per day were counted 5 times at an estimated volume of 80 ml each. So we will compute for the following. First is replacement volume. Second is maintenance volume. Third is your total volume. Okay? You have 2 minutes to do that. All right? Sige, everyone, screen on with your papers. Sasagot na tayo. Okay, screen on with your papers. Let's do the computation. Replacement volume. Body weight times dehydration of 7% times 1,000 times 0.8 increment. That's 10 times 0.07 times 1,000 times 0.08 is 560 ml. Let me see your answers. Did everyone get it right? Okay, good. Okay, very good. Now, our maintenance volume, body weight times 30 plus 70. So that's 10 kilograms plus times 30 plus 70 is 370 mils. Okay, tama? Did everyone get that right? Tama ba? Can I see your papers? Okay, I see 370. Good. Kanina, sabi natin, binanggit ko na kasi kaya hindi ko na sinama. Kailangan ko siyang banggitin earlier. Sabi natin, kailangan natin isama yung ongoing losses. So, gaano kadami yung ongoing losses natin today? At least before the IV infusion. So, sabi, 5 times na siyang nag-vomit. And then, about 80 ml per vomit. So, yan yung ongoing losses natin. So, that's about 5 times 80 ml. So, that's about 400 ml yung ating losses. Tama? Ano ngayon yung total fluids na ibibigay natin in the first 24 hours? So total volume is replacement volume plus maintenance volume plus your exceptional losses. So that's 560 plus 370 plus 400 mil. So that's total of 1,330 mils. Okay? Ayan, so na-compute na natin. Now, how do we compute for the infusion rate per second? Balikan natin yung formula kanina. Balik natin dun sa formula dito, ha? So, kailangan natin yung infusion rate in mil per hour. So, that's 1,330 mils over 24. 60 minutes, pero seconds ang hinihingi. So, we will have an additional divider of 60 seconds per minute. Tapos i-compute natin siya kapag adult at saka i-compute din natin kapag pediatric drops yung gagamitin natin sa kanya. Okay, so using this formula, let's compute for the infusion rate. Let's go back to our problem here. So 1,330 mil. What will be the infusion rate in the first 24 hours using both pediatric and adult set? In seconds. Okay, you have your answers? Okay, so our formula is here. Let's replace that with the numbers. 1,330 mil divided by 24. Then divided by 60. And another 60 for the second mark. And then multiply that by your pediatric drop rate, which is 60. So that's about 0.9, or that is equivalent to around, round it off, that's about 1 drop per second. That's a pediatric drop yan, ha? Now let's go to the adult drop naman, where your multiplier is 20 drops per ml. So that's 1,330 mil divided by 24. Then your dividers for the time are 3,600. So that's 60 times 60 times 20 drops per mil using an adult line. So your result should be 0.3078 mils. So that is equivalent to about 1 drop per 3 seconds. Okay, nakuha? Gets? Okay, hindi nalito? Pag meron kayo nung machine, hindi nyo na kailangan to. No, but it's actually good that you know the how to do it, yung computation niya. Okay, so nakuha lahat? Tama ba yung mga ginawa? Alright. So yun lang naman yung exercise. But the computation should be very simple lang naman. Hindi siya dapat ganun ka-complicated. The complication actually is here when you see this 0.8 here, because that accounts for the yung estimation lang para hindi tayo mag-over over application, over administration of fluids. But the basic formula is here: body weight times dehydration times 1,000. Okay, so this is just parang safety lang siya, computation. So in summary, a fluid therapy plan should include the following. So determine first if the fluid therapy is an emergency or a replacement load. So kanina, it's the acute versus chronic condition. Calculate whether it's an emergency or replacement volume as precisely as possible. Calculate the maintenance fluid as precisely as possible also. Calculate precisely as well the infusion or administration rate. of your fluids. Aside from the fluids, depending on the condition, you have to make sure if you need to put supplements on your fluids, for example, potassium, um, sodium. If you need all these or you need medications, make sure that the medications you use do not interact with the fluids that you're using. Determine the administration route that is best for your patient and monitor your patient at least 2 to 3 times a day. Do not just look at them, but touch them, feel them, do very complete physical examination of them because you want to make sure that you are not uh, overdosing, especially on the fluids, and you are not causing um, fluid over accumulation of fluids in the body because that can be detrimental to the health of your patient. It could be detrimental to their recovery, and sometimes it could actually cause death also. Okay, so going back to our poll question, what do you think is the most critical aspect of fluid therapy? Given all those, uh, given all those that we presented earlier, which one of the following do you think is the most critical aspect of fluid therapy?
Magpapapol po ba tayo, Doc?
Doc, yan yung poll.
Doc, yan nakamute ka po.
Ikaw na yung host. Ikaw na yung host. Pakipindot mo na lang yung poll.
Okay, wait.
Si Rosella.
Ay, yung poll 1 ang nasa akin, Doc.
Yung second one, Rosella. The next one, please.
Wait lang. Doc, wala po din dito.
Paki-return yung host na lang. Paki-return na lang yung host.
Wait lang, Doc.
Right-click lang.
Ayan. Ayan na, Doc.
Teka lang, ha?
Sige lang, Doc.
Okay.
All right, what is the most critical aspect of fluid therapy? Dehydration assessment, choice of fluid, patient monitoring, or route of administration?
Okay, it seems nakasagot na lahat. So I'll end the poll.
Okay, very good. It all starts with that one. Pag tama yung inyong dehydration assessment, the computation of the fluids, actually lahat mako-cover nyo na lahat yan. So very good. Okay, that ends my presentation for this afternoon on the fluid therapy. Any questions po?
Okay, before tayo mag-proceed with the question and answer, which is the next part of our program, I would like to acknowledge the presence of our Elanco participants, Ms. Erica Gonzalez, the Business Unit Head OTC of Pet Health, Dr. Felina Mata, the Brand Manager OTC Pet Health, Dr. Jomer Fule, Technical Service OTC, and Ms. Kat Matias, TSA Handling South Luzon. Ayan. So, now, pwede ba tayong mag-stop share screening na, Sir
Yes.
Dr. Lopez? Ayan. So, before we proceed with the question and answer, let's have picture taking first. So, would like to request everyone to turn on their cameras for picture taking. Ayan. Para we can proceed na sa question and answer portion. So, we will take pictures several times kasi we don't know kung nasama ba tayo sa first. Wait lang, Doc Ian. Ayan. So, Doc Ian, you may count para we know when to smile. Doc Ian, are you there? Ayan. Let us know, Doc, ha?
Po, nandito. Okay. Yes, smile everyone. At saka po pala, naka-record po itong webinar. You may access it later sa Facebook.
Facebook
check
Live.
Naka-on na lahat ang camera. Facebook videos ng page. Shit, man. Smile. First page yun. Second page. Naka-off pa yung second page. Naka-off pa sila. Naku, walang attendance yun.
Baka Dok nahihiya. Nahihiya sila.
Third page. Okay, finished na. Thank you.
Ayan. Thank you, everyone. So, for question and answer, you may now raise your hand to be acknowledged, or you can chat in our chat box here in Zoom to ask questions so that, Dr. Lester Lopez or Dr. Ian can answer your questions. Yan. So, the stage now for asking is open. You can raise your hand po if you want to speak, or you can just chat. Baka may gusto kayong tanongin about the computation. Yan, lalo na yung mga students dito na nahihirapan pa din mag-compute. And, yeah. Ayan, si Doc Patty may question po ata.
Magkano yung scintigraphy machine?
Ay,
Usually, estimate.
Yung machine, wala dito kasi sa Philippines, Doc. Pero ang alam ko meron, nakakita na ako niya sa Singapore. Pero hindi ko natanong kung magkano. Hindi ko alam. I have to ask. May nag-visit kami na hospital dun eh. Yes, Doc.
Pwede? Magtanong? Yung pagka tinanggal mo yung thyroids, di ba nandun din yung parathyroid? Paano
Yes,
yun? Di magkakaroon siya ng problema later on.
Matatanggal.
Tanggal din siya, di ba? Oo.
Matatanggal. Most likely.
Oo. Ano ang maintenance mo din para sa ganon?
Yung sinabi ko kanina, Doc, na actually iikot lang yung disease sa kanya. When you've removed it because of hyperthyroidism, the consequence actually will be hypothyroidism. So that needs to be dealt with afterwards.
Pero yung parathyroid gland,
kasama yun,
gland.
yes po, kasama yun sa kailangan i-address mo siya kung ano yung mawawala. It is the primary, the removal is the primary option, but many are opting for yung hindi yung what do you call this, the therapy, the radiotherapy, or the iodine diet supplementation para hindi mawala totally yung function ng thyroid and parathyroid in case kailangan siyang maalis din.
Doc, my question is about yung sa colloid. Ano yung available dito sa atin, and then what's your take on the colloid controversy?
May siya, Doc. Actually, I try to read about it kasi may experience na rin ako doon before na nagkaroon ng allergic reaction sa colloid. Are you pertaining to that one? Kasi yun yung
Yes, Doc.
naging problema ko sa kanya. Nagkaroon na anaphylactic reaction yung aso a few minutes after infusing the colloids. Depending on the patient, I've had ones that are okay, na walang reaction, pero nagkaroon din ako nung may reaction din. Kailangan gamitin kasi wala ako ibang choice. Lalo na yung human preparation, yung hetastarch, yung mga ganyan. Yun. Wala akong blood replacement, wala akong plasma replacement. The nearest I could use was that hetastarch, so I used that. Unfortunately, there was one patient na nagkaroon. Kaya lang, since, yun nga, my point, my take here, since wala akong ibang choice, I used it. Ayun
Thank
po.
you, Doc. For ordinary cases, for example, meron tayong pasyente. Anong minimum database na that should be available before we begin fluid therapy? I'm referring to mga laboratory tests.
Opo. Yung basic, Doc, do the basic blood test, which is your CBC, check the creatinine, the SGPT creatinine, the liver and kidney functions, check the glucose also, electrolytes, see if you need any of those replaced also. Yun po yung kailangan na basic sana. Meron ba, Doc, na ano? Doc, meron naman ng electrolyte machine sa inyo, ano?
Yes,
At least
Doc.
yung basic. Meron naman access po ang mga vets.
Yes, Doc.
Yun. So sana yun yung basic sana. Kasi that
Yung
will also determine.
assessment, Doc. Assessment ng pasyente. How often should the patient be assessed if naka-fluid, for example, naka-IV?
Apa. Okay. Kasi remember, the fluids that you're replacing is equivalent dun sa supposedly fluids na nawala sa kanya, so that affects the weight of your patient. So assessing the patient 2 to 3 times a day, checking the weight, doing the physical exam, checking if there is parang edematous sections dun sa katawan niya, sa legs, dun sa part na naka-IV, dun sa whether sa harap or likod ng paa siya naka-IV. Check if there is infection. You have to do that 2 to 3 times a day at least. So meron ka, if you have maybe a vet nurse or a vet assistant doing the rounds, dapat kasama yun sa mga tinitignan niya twice or thrice a day.
Sa mga students natin, baka may question sila. Okay, wala ako na lang. Doc, sa tingin mo, underdiagnosed ba yung mga hypothyroid cases dito sa Philippines? Kasi hindi tayo madalas nagtitest o marami lang obese na pets?
Sa tingin ko, Doc, personally and sa practice, yung sa sarili kong practice, I think madami tayong underdiagnosed na cases. Or halimbawa, parang you have the clinical picture, you see it now, tapos you check for the thyroid, pero okay pa siya. Tapos, dahil okay siya nung time na yun, parang you tend to forget about it. Parang hanap ka ng ibang diagnosis na sometimes you have to repeat the test, you have to redo your test, check again. Kasi sometimes the condition, pwedeng starting pa lang, pwedeng influence siya by other hormones. Kaya at the time na nag-test ka, kahit alam mo yun, at the back of your mind, ang iniisip mo, baka thyroid problem ito. Parang gano'n. Yun. Sa tingin ko, kulang. Yung mga symptoms niya na pwedeng symptoms ng ibang sakit, hindi siya naisasama sa differentials. Not just, basta yun, usually kapag nagiging sluggish sila or tamad or tulog ng tulog, there's weight gain with regards to hypothyroidism. There's weight gain and then there's skin problem. Yun, isa yun sa mga, sa akin, sa tingin ko, immediately dapat isasama mo sa differentials mo yung thyroid problem at a certain age of the dog. Yun, kaso hindi. Minsan dahil skin yung mas prominent, minsan kasi sasabihin ni owner, Dok, ang lakas lang kumain yan eh, kaya tumataba ng tumataba. Sometimes you tend to agree. Tapos dahil mas prominent yung skin problem, you tend to work on the skin problem only and not delve into the possible deeper problem. So sa akin, sa tingin ko, kapag may ganung symptoms, isama siya sa differentials.
Doc,
Yes po.
Okay, Doc.
Sa practice natin dito, ano yung mas common? Hypothyroidism o hyperthyroidism sa practice natin? Sa Philippines, I mean.
I think hypo. Wala akong figures pero mas commonly reported ng vets or napag-uusapan yung hypo po.
Okay, minsan kasi conflicting yung mga, tama ka, sinabi mo, minsan mataas yung D3, T4, tapos yung mga TSH, di ba, mga ano yan, combination. Tapos biglang pagkataas ng ilang period, iba na. Tapos nagkakaroon ng, manghihirap kasi i-diagnose yung hypoadrenocorticism. Ewan ko kung, tsaka hirap din gamutin, parang halos ang hirap talaga, ano? Ewan ko, paano yung approach ninyo sa ganyan?
Yun nga, well, yun din yung yun din yung one of the lectures I attended a few years back, I remember, yung with regards to the adrenal, kasi pwedeng mag-mask si adrenal sa thyroid problems, sa hypothyroidism in particular. So you really have to establish. So kapag mababa naman talaga yung T4, FT4 mo, and consistent siya dun sa symptoms, then you pretty much have a good diagnosis of hypothyroidism. Yun naman po.
Yun na nga, kuminsan nag-conflict. And, di ba, yung hindi siya parehas hindi siya dun sa in-expect mo na result. Iba yung pinapakita sa physical, iba yung pinapakita sa blood test. Now, you would conclude that it might be a hypoadrenocorticism, pero ang hirap nga mag-diagnose. Anong ginagamit yung diagnostic tool para sa Addisonian disease?
Sa Addison, actually, Doc, wala cortisol level. Sana. Kaso, hindi siya reliable kasi we're using human machines, human test. So, hindi siya 100% reliable. Yon sana. Differentiating. Kaya diagnose mo yung Addison's. Pero right now, we are using human machines.
Okay. Doc, meron po tayong question sa chat. Pa-refresh po, paano? Ay, okay, nasagot na pala. Ako, Doc, may tanong ako.
Yes po.
Ako naman. Kasi Doc, di ba, hindi naman po kasi lahat ng clinic available po yung PT4, ganyan, pati FT4. May certain differentials po ba na pwede tayong i-check through CBC? Or wala? Hindi siya reliable for diagnosis?
For hypothyroidism, no, you really have to rely on the thyroid levels in the body. So you have to do that.
Underdiagnosed po pala talaga siya kapag dahil nga.
Wala pa sa Palawan. Doc Ian, meron ka?
Hindi ako familiar. Doc Ian, may TT4 po ba kayo?
Meron.
Baka meron. Ayun, meron. You can refer for the test.
Yes naman.
It will be very helpful. Very, very helpful yan.
Question, Doc. Yung sa L-thyroxine, pag merong signs ka na nakikita, tapos yung result na binabalik sa'yo ng laboratory is borderline lang naman, would you start yung supplementation?
The levothyroxine, not yet right away. You can go with yung mga nutraceuticals, yung mga ganyan. Try mo muna. Kung mag-work sa kanya yon, then hindi kailangan agad. Kasi not necessary naman. At saka ganito, Doc, you have to establish na, kumbaga hindi lang siya one time na mababa. Kumbaga you're doing series of tests sa kanya to establish it. Yun. So kung hindi naman siya, kung borderline pa lang naman siya, diet change can influence that, yung iodine levels, yung ganyan po, yung supplements na pwede ibigay sa kanya, that will influence that. So sa akin, not necessarily treat right away.
Doc, na-mention mo kanina yung pagsi-shave ng nung pag naglalagay ng IV.
Opo.
Maraming owners ayaw eh.
Parang it's a necessary procedure, parang ganon. Kasi masakit yun actually for the pets kapag multiple times. So if you will hit it one time, well and good. Kaya lang, if there's too much hair in it, it's not just aseptic. Syempre, pwede magano doon yung bacteria, mag-thrive doon, tapos hindi mo siya malilinis ng maayos. Tapos, syempre, lalagyan mo ng antiseptic yon. Tapos, lalagyan mo ng alcohol at saka ng, if you have Chlorhex, ganyan. So, pwede magkaroon ng moisture retention, pwede ka rin magkaroon ng phlebitis. So, ayaw mo mangyari yon doon sa patient. Sabihin na lang na it's necessary. Kailangan malinis talaga yung part na yon. Para sa iyo, hindi ka rin mahirapan mag-IV sa atin as vets. Pangalawa, para hindi rin masakit doon sa patient kapag hindi mo siya na-hit during the first time kasi hindi mo makita or maaninag or ma-feel ng maayos. So, less pain din yun sa kanya. Yun. But initially, but more importantly, dahil kailangan malinis siya. Tutubo naman yun.
Ayan,
Pero
Doc, we have
question,
questions sa chat. Are there
prescription
prescription
diet.
diets? Opo.
From Royal, we'll have to ask them kung ano yung marirecommend nila. Hindi ako sure kung alin doon ang pwede.
Yan.
Pero
Any
yung
more
mga,
questions?
Yung mga patients kasi na may hypothyroidism naman, most of them naman walang nababago dun sa food nila. If it's confirmed hypothyroidism, as long as nakamedicate sila.
Doc, question. Halimbawa, emergency basis, anong gagamitin mong fluids kung kailangan mo na?
Ang ang safest bet mo are yung mga isotonic fluids. So, NSS. Yun ang safest bet mo, Doc. Yun ang pwede mong gamitin anytime, anywhere. Tapos i-replace mo na lang pag meron ka ng yung proper fluids. Yung tingin mo mas appropriate po sa condition.
For medications, Doc, anong best na fluids?
NSS din po. NSS or LRS. For sub-Q fluids, NSS or LRS lang din po. Yan, yun yung mga
For specific cases, Doc, anong fluids ang pinakamataas ang potassium? Halimbawa, may parvo.
Sa parvo, ang recommended kasi, Doc, actually is you measure that. Bago mo ibigay yung fluid, measure first the potassium, measure the losses. So kasama yun sa gagawin mong test. Kaya lang, hindi natin ginagawa yun routinely dito sa atin na minemeasure natin ang electrolytes ng parvo patient. Pero it's supposed to be done para ma-replace mo yung ng tamang computation, yung potassium, sodium, yung mga ganyan. Or whatever is lacking dun sa pasyente. Kasi pag masyadong mataas naman ng potassium, Doc, cardiac ang complication. So, hindi ko masasabi na kung ano yung pinakamataas na may potassium na fluids kasi it needs to be computed po based dun sa needs ng patient.
Routine ba, Doc, sa iyo yung paggamit ng potassium chloride para sa yung mga very low levels ng ano?
Yung mga vomiting, yung ganyan. Sa akin, hindi. Not really. I don't measure potassium all that time. That's on my end. Pero the proper is it's supposed to be measured when there's vomiting. Or when there's losses. Yan, para ma-replace siya ng tama po.
Yes, Doc. Anong dapat i-record ng mga natin? Anong dapat i-record? Anong dapat na i-record natin kung may animal tayo na naka-IV?
Naka-IV?
Sa anong dapat mag-reflect sa follow-up form niya sa records ng patient?
Okay. So yung initial mo, syempre, you need to have your the blood test. So that's a basic. And then include there your electrolytes, yung minention ko kanina. And then you will be computing, for example, if there is deficit in potassium. So you need to make sure that you repeat the test after 24 and 48 hours. Kapag normal na siya, you need to stop giving the external source of that one. Kasi supposedly the body is able to produce that already. Ganun. So example lang yon na mga pwedeng i-measure sa kanya and i-record every day. Then the weight, yung sabi natin kanina, get the weight every day. Tapos make sure na pattern yung IV line mo, make sure na follow yung drip rate or yung infusion rate mo na kinompute mo nung una na dapat by this time, nakaganitong volume na siya ng replacement fluids niya. So you have to make sure that that is recorded also.
Thank you, Doc. Any other questions po? Parang wala na, Doc. Satisfied na silang lahat sa iyong lecture. Salamat, Doc.
Thank you.
Thank you. I-mention ko lang yung mga participants natin ngayon ay mainly from Aklan State University. Medyo marami sila from, kasi in-invite ko si Doc Gloria. From Central Bicol State University kay Doc Vivian. From Cavite State University, si Doc Melbourne. At saka sa UPLB, care of Rosella. Marami rin dito ay meron din pala from Northern Luzon. And then I think Rosella announce na tayo ng winner kanina.
Yan. See anyone from Elanco, Doc Jomer? Can we announce the winners from our game?
Okay.
Ayan.
Kita na po ba yung let me Yan. So ito po ang winners. Ito po yung tally ng score kanina. So nanguna po sa atin ay si Adrian Perfas and si Rafael Michelo Hormigos. I hope I was able to pronounce the name correctly. And then ang pangatlo po ay si Dr. Raisa Merel Lagrimas. So congratulations po. Palakpakan natin yung mga winners po natin. We would like to kindly ask po yung inyong contact information and yung mga yung address po para mapadala po namin yung mga prices po sa inyo. So you can contact po either me or Dr. Felina Mata. So nandito po yung number namin. My number is 0917-507-8576. And Dr. Felina Mata, yung aming pong brand manager, is 0917-861-5281. So again,
Ayan.
congratulations po to our 3 winners po.
Thank you, Dr. Jomer, and thank you for our winners. So, Doc Jomer, dyan po ba si Miss Erica Gonzalez?
Hi, yes po.
Ayan! Hello po! Ayan, ma'am. I heard
Hi,
we will
Rosel.
have a
Hmm.
closing. Ayan, ma'am. So now, you may now proceed for for
Thank you, Rosella. Yeah, once again, congratulations po doon sa lahat ng nanalo sa ating game. It only shows how engaged you are dun sa ating lecture kanina, no? So, first of all, thank you, Doc Ian. Thank you for giving us the opportunity not only to present our company's mission, vision, our purpose, but more importantly, no, for giving us the opportunity to share yung expertise namin sa veterinary field, no, care of Dr. Jomer and of course Dr. Lester. So to all the vets who attended and who are still here in this call, we hope that you found the session of great help to your profession. And I know that there are lots of students here ngayon from all over the Philippines. Thank you very much for attending, and I hope that you also found this helpful and also inspiring enough for you to continue to push through doon sa chosen course ninyo. And I know there's still a long way to go for you guys. So as mentioned by Dr. Jomer earlier, no, we are in the animal health industry, and tayo pare-parehas, we only want to give the animals the best care there is, diba? The best care that they deserve. So we hope to be able to continue to work with you guys individually or collectively so that we can ensure the safety and welfare of all the animals around us. So again, thank you, Doc Ian of Dalubhayop, and to everyone who are in this call. Have a great day and stay safe.
Yeah. Thank you, Miss Erica.
Thank you.
Ayan.
Thank
So,
you.
Doc Ian, are we, ano na po ba? Are we done for everything? So, okay, for
everyone.
next week, we also have another series here in the Dalubhayop Tech Talk. We will be discussing about heartworm prevention and treatment. So, it would be on May 18, Tuesday, 2 p.m. So, for further announcement regarding the schedule and for the registration, just keep updated sa page ng Dalubhayop. Ayun. And we will be spreading it out and posting it in social media. Ayan. So, Doc Patty, do you have questions po?
Mali yung number ni Doc Jomer. Tingnan mo, ang daming number. Tingnan mo yung binigay niyang number. Paki-check. Yung number na nakapost, parang sobra. Tama ba? Parang 2, 4, 6, 8, 10. Ang dami eh. 12.
Wala pong 9, sorry.
11
So
lang.
my number
11 lang
po
dapat,
is
11.
Ano?
my number po is 0917
Ah,
507 8576.
5078. Wala yung 9. Okay,
Wala
thank
po
you.
yung 9. Sorry for that. Thank you, Doc Patty.
Thank you, Doc Jomer. Ayan. So, ayun, would like to, invite everyone. Next week, we will have another discussion for heartworm naman. Heartworm prevention and treatment. So, I hope everyone who was here will also be attending for next week's discussion. It would be very interesting. Lalo na if you have your companion animals with you in your house, you know what to do, you know what symptoms to look for, you know what clinical signs should we be taking note na baka, they have heartworm na need to go to the vet or to give certain medication. That's all, everyone. Thank you. Thank you for joining us today. Thank you, Dr.
Thank you
Lester
sa lahat.
Lopez.
Thank you.
Thank you,
Thank you sa
Elanco,
mga
for
speaker. Resource
sponsorship.
person natin. Salamat.
Thank you to all
Thank
veterinarians and vet students here. Ang sipag nyo.
See you next week.
See you
Yeah.
next week.
Doc Ian, thank you. Nice
you
to meet
po.
you virtually.
Yes. Thank you. Thank you.